Hello and welcome to Covell Conversations. My name is Krista. I'm an occupational therapist and I own a mobile outpatient practice in Colorado. I have often referred to Covell Care and Rehab as the island of misfit toys. And if you are familiar with the movie Rudolph the Red-Nosed Reindeer, the classic, then you probably have some sort of recollection or memory of the island of misfit toys, which is where all the toys go that don't really belong, such as a train with square wheels or a polka dotted elephant. I personally like both of those things. And I often, as an occupational therapist, working in the mainstream medical models that I have worked in, which includes home care, inpatient hospital settings like acute care, rehab, skilled nursing, outpatient, traditional outpatient, and also mental health services in the hospital setting, I often felt like I didn't fit in. And I think that's normal, kind of human nature. But as an OT, I was always looking to develop new programs, or I wanted to paint the gym, or I would get a wild idea of something new we could do. And so I was just always veering off of like the mainstream expectations of an staff therapist. And it was great though. It was a creative outlet for me. It was supportive to the patients that we served. And then in the long run, it ended up bringing me to be at Covell Care and Rehab, where I feel like I can be very creative, and we've created a business that truly is not like anything that you see in mainstream healthcare, yet we can still bill insurance. We work with physicians. It's been a labor of love, but also kind of a practice that doesn't fit in the mainstream medical model, hence the island of misfit toys. That also, and this comes from a place of love, speaks about a lot of our patients. These are patients that maybe they don't qualify for home care, but they still have needs that require skilled occupational, physical, or speech therapy. They might have diagnoses that you don't necessarily go into an outpatient clinic and get treatment for, such as Alzheimer's disease. You're not going to bring somebody with Alzheimer's disease into an occupational therapy clinic and work on bathing and then send them home with their loved ones. That's not going to be impactful at all. Or mental health disorders like complex PTSD or bipolar 2. You might have a therapist, a counselor, a psychiatrist, but it's so important to have an occupational therapist. Post-concussion. And these are the patients that often fall through the cracks. And when they fall through the cracks, the nice thing is that we try to have a little island down there in that crack, which is the island of misfit toys for us as therapists and for the patients that we serve. So I'd like to share one little tool thing that I talked about with a patient today, and it's in this little green kit. I used to always call this an anti-anxiety kit, but sometimes I don't even like to say the word anxiety or anti-anxiety. So sometimes I just talk about this as like a sensory support kit, or I have patients give it a name, like my green friend, whatever it might be. It can be silly. It doesn't matter. It just needs to resonate with the person that's using it and building it. So together we talk about bringing in our five senses and what this does when you're having an episode of intense fear, anxiety, deep depression. We have these neural pathways that continue to repeat themselves in our brains. And what we know is that a somatic, like in your body, influence can have an output that can reduce those feelings that we don't want to have, which is why people, not just patients, people self-medicate, whether it's alcohol, drugs, shopping, Netflix, binging, staying up late, doing things that don't necessarily serve you, but they do at the same time because they're reducing your anxiety and stress. Maybe offloading some of your depression, but it's a non-healthy way to manage those emotions and feelings that we're having. This is also where we see things like self-harm come into the picture. So some of the things we talk about have to do with the five senses. So like right here, I have a bottle of lotion. It smells really good. It's also from a friend of mine. So it makes me think of her and some trips that we take with some of my girlfriends. And when we go, people bring little things to take away, and it brings back memories of good times, great friends. And when I put this on my hands, it smells good. So that impacts my sense of smell. And then it also kind of is a little bit of a hand massage. I can take my time to do that, which again is kicking in my parasympathetic nervous system, which is the part of our nervous system that calms our whole system down. So we want to engage that part of our nervous system. I also have some quotes that I enjoy that I keep in here, and I can pull these out. So for example, this one: you must not ever stop being whimsical, and you must not ever give anyone else the responsibility for your life. And this can give me empowerment, and it's something for me to look at. It's also something for me to hold, rub, and it's a tangible thing. And so instead of me thinking like, you can do this, you don't have to think this way, don't do that, you're worthy, you're this, you're that, calm down. This can help ground me in and of itself. And it's just a little piece of cardboard. Another thing I have is a hand sanitizer that I really like called a Caribbean Escape, because who doesn't want to go to the Caribbean and smell all the beautiful flowers? I do a lot of things with scents. This was an essential oil that a therapist gave me, actually a speech therapist, when I was going through grief. And this is a combination of scents that is supposed to help with grief. So I put that on. It's a roller, so I could actually put it on my skin, take some deep breaths. And again, I'm touching that, I'm feeling that, and then I'm breathing it in. Something that can be really grounding, something right from the ground. This is a rock. This is a lava rock, actually. And you can find one that fits really great in your hand, just feels good. So even if you're hiking, walking, you can just pick this up right out of your own yard. Something that you can feel like you can squeeze and hold can be very grounding. Even if I was sitting in a meeting and I had this in my hand, nobody's really ever even going to know. So if I'm going to class and having a lot of anxiety, or I can pass this back and forth, it can be a little bit of a fidget toy. You can use things like that. We talk a lot about breath work. What better than having something that actually forces your breath to slow down than bubbles? So it causes the parasympathetic nervous system to kick in. Mine also has Wonder Woman on the top, because why wouldn't it? You can pick these up at the dollar store. Oftentimes they'll have like 10 of them in a pack for $1.25 or whatever it is. And that way, if you go through them, you can just not worry about, the cost isn't super high. Lavender, we know that this is a calming sensation or calming scent. Some people don't love lavender. That's okay. You have to do what speaks to you. You can smell it just like that. Take some deep breaths. You can put a little dab on your hands and rub it on your skin. Let's talk about taste. I have a Jolly Rancher in here. Even that can reprogram your anxiety to all of a sudden have a sensation in your mouth. Crackers, something crunchy, we know that actually increases your ability to concentrate, which is interesting. So sometimes if people are taking a test and they're stressed and getting distracted, sometimes eating something crunchy will work. I talked to a patient yesterday that even in the evening, when she likes to sit down and watch some YouTube videos that she really enjoys and catch up with what's going on some of her hobbies that are supportive to her through YouTube, she has a hard time concentrating on those unless she's eating chips, which is kind of her passive stimulus. Now, of course, we don't want you eating 10 bags of chips every day and all that kind of thing, but these are things that you can take away as tools and figure out what works for you and how that can be supportive. Because then once she can concentrate on her shows and get the information that she wants, she's calmer and she's winding down her day. This is a little bit of verbiage just about my family that I carry around as a reminder. I have a patient that has a Polaroid camera. She's going to go and take some really fun pictures of her kids and stick those in there. I always keep a little notepad and pen. That way I can write down something that I need to think about or my stressors. We know that if we get things out with paper and actually doing the tangible writing, this is good for our brain. So if you're just thinking I'm stressed out and you want to write down all the things that are stressing you out right now, put it in here, or flip the script and say, I'm so stressed out. I'm going to write down 5 things that I'm grateful for. Okay, I'm still stressed out. 5 more. Keep going until you feel that engine that's revving in your chest or in your mind calm down. Another grounding piece that I have is a seashell. This is a cute little shell that one of my kids picked up at the beach. It has some shells lodged inside, but this is also a really easy one, and I can throw this in my pocket. It's nice and smooth, and I can rub it. Kind of gives me that sensory input that can also help to reduce the overstimulation that we might feel. I have chapstick, another Jolly Rancher, and then if you have any sort of faith or belief in a higher power, you could have something in there that represents that. This is also really easy for me to rub. Sometimes I'll even put it in my cup holder when I'm driving around, and it kind of brings me back to being in a place of providing service, and it reminds me of what I'm doing and why it's important, and not getting caught up in the notes and the care coordination and all the things that has to be done in order to have a private practice. So these are some things that I keep with me, and you can think of different things that would help you and gather things around. This is also a nice thing to do with your children. Friends, you could do it getting together with some girlfriends. Just tell them to bring everything together, and maybe you make a fun bag or anything like that. You could go on a nature walk, find things that you find grounding. You can also put things around your house, like a bowl of stones that you like. When I went on a beach walk once with my mom, she picked up a bunch of really smooth stones. I was looking for seashells, and she found these stones that she just really loved. And they sit in her bathroom, but they also can get picked up and you can rub them. And again, that's somatic sensory input that can really help with anxiety, stress, overload, and overwhelm. And in this day and age, we know that so many people are feeling burnt out, stress, and anxiety is at an all-time high. So we want to put tools into place that allow us to be more functional in our day-to-day lives. This is not something to be added as extra or foo-foo or woo-woo. These are strategies, just like if you exercise and you're trying to get stronger physically, this can help you have mental and cognitive strength. So there's different tools that can be used. And that's just one idea that we have that many clients really enjoy, and it feels very personal and supportive to them, and something that they can put in their glove compartment, put in the basket of their walker if they have one, keep it in their bedroom, throw it in a suitcase, or even take one thing out and put it in their purse if they're going to have a rough day, anything like that. So I hope that's helpful. If you do anything like this, or you have other strategies that really help in that vein of interrupting our thought processes when they're not serving us, that includes using your five senses or disrupting that thought pattern that's healthy, we would love to know. So please share. Thanks. See you soon.